Hi, we're here with Dr. Tamyra Comeaux. Dr. Comeaux is board certified in OBGYN. She is board certified in anti-aging and regenerative medicine, board certified in integrative cancer care. She is an herbalist and essential oilist and specializes in a lot of things. And she's a big part of our wellness program here at Radiance. So we have many patients who come to you who have been to 15, 20 healthcare providers who can't figure out what's causing their symptoms. And what amazes me about you is you kind of take all these puzzle pieces, put them all together and figure out what's going on. And I know you spend a lot of time with your patients. Tell us what a typical visit might look like.
Right. So when people come to see me, well, first, when they've gone to all of those other specialists, they usually haven't spent an hour with any of those people. They've spent, 15 minutes over here and 15 minutes over there, and the doctor really focuses in on what their thing is. If they went to the thyroid doctor, I usually know before I even see the patient what medicine they're on. There aren't really that many. And they've been to the rheumatologist and they've been to an endocrinologist. I mean, that's usually the triad that I see people come in with. Plus they have their primary physician. And they're each focusing on their one piece. And then I will speak to them and say, well, all of your diseases have like a magnesium deficiency in common, and they also all respond to this hormone. And they're like, no. I was like, yeah, they wouldn't have thought that because they did not know that to think it. So a lot of times I put people, put different pieces together, and they'll also, come in and if you've seen several physicians that haven't really helped you a lot, you'll be very sad. Nobody can figure me out. I'm just an enigma. I know you've never seen anything like that. And I'm like, no, you're my fourth one today. So you have good company. I should start a support group after office hours for everyone. But I just tell them, I'm like, you've been getting worse for so many years. All I have to do is turn you around and start you walking the other way. And that's actually not difficult. Trying to say tomorrow I'm going to be normal, that's difficult. Nobody can promise you that. But saying we have a plan and we can turn you around and start you walking in the other direction, that's actually not difficult. And once you tell people that, they're much more willing to work at it because, there's a plan. I'm going to find a vitamin deficiency. Nobody's perfect. I can find them on myself all the time. I won't find 10, but I can always find one thing I could be doing better. I'm going to find a food that's not working well for your body. Nobody else looked, but I'm going to look, and we're going to find something that's fighting with you. And I'm going to find probably 2, 3, 4, or 10 hormones that could be better, even if no one else found that they were completely lacking. And by the time we put all that together, you will just be on a very different path than the one that you were previously on. And that will help all the other doctors not have to keep adding medications to your situation. And that's just what I do over and over. And since I do it so much, it's easy, to me, I find it easy, but 20 years ago, I would have thought that was what I'm doing is impossible, but then I started doing it.
So if you'd like to see Dr. Comeaux, give us a call here at Radiance.